It's day 12 after my mastectomy surgery. As you can see, I've still got a significant amount of bruising. The swelling's gone down enough though that you can see the tube that comes all the way around there and drains out. And I'm just doing this video for people who, if you ever have a mastectomy and you want to know what it looks like beforehand, this is kind of what goes on. I, of course, am not getting any reconstruction, and I'm a little on the large side, so there's a lot of wrinkling. And the bruising is more significant than it would be for the average person, just because, well, I had a bleed after my first surgery, so they had to open me back out, suck it out, or open me back up and suck it out, and then stitch me back together. So I have more bruising than you will probably have, but it's healing up fine. And down here you see this is the little JP drain, or as I like to affectionately call it, my blood bag. And I am going to empty it. So there's not hardly any of my body juice still coming out. It's just like a couple milliliters. But this is kind of what the process looks like. And here you can see I've got it on my handy dandy shower cord. It's just a piece of nylon cord that I wear when I'm in the shower to keep it safe so that it doesn't fall out or fall down and pull on the stitches, which right here they are pretty uncomfortable. But I don't think it's infected or anything. It's just I've got sensitive skin. Whenever the tubing touches my skin, it causes kind of a red welts and blisters and things, so I try to keep most of the tubing away from my skin with gauze pads and things like that. Anyhow, so here's my little measuring cup. As you can see, I take the drain, hold on to this part, pop the top off. I've washed my hands already, just had a shower. Turn it in, drain out what little dribbles there are. Fold it in half, and then, because this part tends to be a little more messy, I grab my handy dandy Kleenex and just shove that sucker back in and clean off any excess. Every other day I will clean this off with alcohol, but usually I just use the Kleenex and that goes in the trash. Now, as you can see, there's hardly any. It's not very bloody. It's mostly just bodily fluid floating around in there. And I'm going to take this right over here into the bathroom. And down it goes into the toilet. And flush. Now I take this, rinse it. I don't worry about getting it too clean because honestly, you know, it's just disposal. It's not like I'm licking it or anything. And then I wash my hand with soap. There's the soap. And I'm done. Now I will wrap the whole wound with gauze bandages underneath here on the top. And then I've got my lovely super wide ACE bandage that they gave me at the hospital, which I've already washed a couple times since I've been home, and wrap myself up. Now I'm not wrapping myself very tightly anymore. I'm just trying to keep it so that the gauze bandages stay on. Every surgeon's a little different. Some of them will take the drain out after 7 days. I've got to still wait almost a week before I get mine out. And because I'm super sensitive to adhesives and things, I just put the gauze bandages there and then wrap myself with ace bandage. Thank goodness I haven't had a reaction to that yet. And I'm healing up fine. The stitches kind of pull and the tubing rubs against my ribs, but otherwise things are good. Anyway, there you go, emptying a JP drain.